Once the epicenter of the coronavirus pandemic, Los Angeles may now be heading toward achieving herd immunity.
I'll also share projections on how long it may take to get us close to community immunity. And we have probably over 2 million more first doses to go before 80% of all LA County residents 16 and older will have received at least one vaccine. At the rate we're going, we expect that we can reach this level somewhere in mid to late July.
That could mean enough people will have immunity through vaccines or having already been infected that the spread of the virus would not cause an outbreak.
It doesn't mean that people who haven't been vaccinated can run to a bar and yell at other people over the bar and not worry about getting infected. It does mean that the number of cases will go down. It does mean we can open things that have been closed. It does mean we can start having church services and indoor classes and things that we had stayed away from over the course of the winter with much less danger.
And it comes just as the state of California is eyeing June 15 for a complete reopening. But herd immunity will not necessarily bring an end to all of the restrictions and precautions.
If you go to a ball game or something, those are outdoors. But if you were to do it indoors, like a basketball game or something, you'd probably want to wear a mask. That'll be mandated anyway. You're not going to get a lot of choice about it. But those are the sorts of situations, big crowds closely packed together, that you're going to have to be careful about. And you need, this virus hasn't gone away. Immunity from the vaccine is amazing, but it's not 100% protected. It's not 100% perfect.
At least 1.2 million people have already been infected with COVID-19 here in Los Angeles alone, one of the hardest hit counties in the whole nation. In addition to those who naturally acquired immunity, nearly 5 million have been vaccinated with at least one dose. And now, with children becoming eligible for vaccines, the prospects of reaching herd immunity in late July appear quite likely. But with the reopening and increasing travel in and out of the country, places like Los Angeles are hardly isolated, and that collective immunity achieved in any area could be far from durable.
There's a new Indian variant that's a little bit less susceptible to the vaccines we've been using than the prior variants that's causing most of the trouble in India. We already have it in San Diego. We identified it in a woman who just returned from traveling to India.
The reality is that outbreaks around the world could potentially start smaller ones anywhere else, emphasizing the importance of a global effort toward vaccinations. Ediz, Tiyansan, CGTN, Los Angeles.